Hi, I'm Dr. Kelsey Lunt, owner of Lunt Chiropractic, and we're going to demonstrate some extremity issues that we typically see in the office here. A lot of people don't know that chiropractors are not only trained in treating the spine, but every joint in the body, and extremities in particular tend to respond really well to chiropractic treatment. So one of the main things that we'll see a lot of the time is some carpal tunnel syndrome, elbow pain, wrist pain, forearm pain, especially as people are chronically using their phone or they're doing a lot of fine dexterity movements like typing. That can present with some wrist pain, it can present with some numbness, tingling, but there's multiple areas of entrapment that the carpal tunnel can be affected by. So the main area that we would focus on when somebody was complaining of wrist pain initially would be at the forearm area and the elbow here. These muscles are all the muscles that control the flexion and extension in through your wrist and hand, and one of the areas that your nerves for your wrist and hand run through is up near the elbow here. As you're using your hands repetitively, these muscles will often become inflamed and a little bit irritated and can pinch on some of the nerves that are surrounding the area and reproduce some carpal tunnel syndrome. So in going to treat symptoms of the wrist and hand, we'll often concentrate on working in through the forearm first, because these muscles have a tendency to refer into the back of the hand and through the wrist area, because this is the control of the hand and the wrist is these muscles here. So in combination with a couple other therapies, we can do some stim on the forearms, a little bit of heat in order to loosen up. I would be doing another sort of pin and stretch of these muscles. So we hold down some of these extensors in through the forearm. We're gonna kind of rotate back and forth, and that's gonna create that pin and stretch in through the muscles here. I will also do not only rotation, but because we're gonna be flexing here, I'll have her squeeze her hand. That's gonna further contract the muscles that are underneath my thumb right now and create that pin and stretch sensation, and then we have her relax, and we go in through a couple more areas and do the same sort of situation here. A lot of the time people will complain that when we're working in through these muscles, they feel it in the back of their wrist or it reproduces some of the symptoms that they're complaining of. That's usually a good thing because it means that we're working at the right area. If you can push on a structure and reproduce some of the symptoms, there's a good chance that at least some of your symptoms are coming from that area. In combination with some of the muscle work, we would do some gentle adjustments in through the elbow here. We would assess for where some of the misalignments and lack of motion is occurring, and we would add some motion in through those joint segments in order to loosen things up and alleviate some of those symptoms. At-home exercises include a lot of bracing. You want to try to avoid doing too much gripping, especially with the same hand, because it keeps those muscles contracted. Especially at night when we're sleeping, we have a tendency to want to curl up, and again, that keeps those muscles contracted, which will put some pressure in through the nerves. So we'll often recommend either putting a brace on at night or keeping your hand and your wrist open while you're sleeping so that you're not maintaining that contraction throughout the rest of the night. We're not only trained in treating the wrists, we can treat all of the other extremities in the body. If you're someone that suffers from ankle, knee, wrist, shoulder pain, or any other extremity pain, please give us a call at 594-0026 or visit us at our website at luntchiropractic.com.